Hi, I'm Rachel Katz. I'm a physical therapist in Boulder and Longmont, Colorado. I want to talk today a little bit about theories of injury and theories of rehabilitation to help you with healing. So I have my little cartoon characters, Gumby, with me today, and I have Pokey. And today Pokey's got a hurt paw, except it's not a paw, it's a hurt leg. And so you can see that Pokey's leg is drawn up and not bearing weight for Pokey. So let's talk a little bit about injuries and how to get back to free, fluid, easy movement, and that's Gumby, where everything moves nice and easy, fluid, easy motion. Okay. So we can have an injury from a lot of different causes. Sometimes it's from a disease like arthritis, wear and tear, wearing out arthritis. Sometimes it's from an inflammatory reactive disease process like rheumatoid arthritis. But what I really want to focus on today is more of the more typical run-of-the-mill kinds of injuries, like you fall down and you hurt your shoulder and then it doesn't seem to get moving again well, or you have neck pain that no matter what you do, you stretch it and it still stays tight, or just an injury that is slow in resolving. So that's what our focus is going to be today. So with an injury, say for example you fall down and you strain your shoulder. Well, maybe you tore something in the mechanism there in the shoulder, and then it takes some time to heal. If you completely tear enough stuff in your shoulder capsule, it's not going to do very well over time, and you might need something more elaborate than rehabilitation alone. You might need to have a surgery, but we're going to set that aside. We're going to talk about injuries that are in this rehabilitation spectrum of healing that aren't involving surgery. So you have an injury, an inflammatory process sets up, that's part of healing. You'll get the development of scar tissue, and that's a good thing because you need to fill in the tears. And then over time, as you get things moving again, that enables the tissue to remodel and go back to its normal functioning. And a lot of people take care of themselves and work with this process on their own. But if they're not getting progress, then they might need some help. So some of the theories out there for when somebody comes in for assistance are that there's scar tissue that's too much scar tissue, and the scar tissue is limiting movement and needs to be stretched and lengthened back out again and helped to be more supple. Another theory that we operate on with rehabilitation is that the muscles have become weak from lack of use, and so we need to strengthen them back up again, and that'll resolve your pain. Another theory that we work with is that we have to calm down inflammation. There's this ongoing cycle of inflammation that we need to break that somehow, and have less of the chemical reactivity of an inflammatory response going on in the tissues so that the pain will go away. So we have stretch and strengthen so that we lengthen an area that's not moving so well, like if we have limited movement here, and then the area has healed from the injury, but it still won't come back down and move nice and easy, and so you still have a limp, or you can't reach as far as you could normally, or you can't sleep comfortably. So what do we do about that? Another couple of theories that I'd like to bring up that are pretty much under the radar for creating an ongoing influence on healing and regaining comfort. So the first one is called a freeze response, and that happens in the presence of overwhelming threat and fear and helplessness. And that has a big impact on how the muscle system in the body works. So one of these sleeper theory ideas is called a freeze response. And so I'm going to bring up my Wild Kingdom book here, and So here we've got a jungle, and we got some monkeys hanging out in our jungle. And down below, whoops, I have to turn it around. Down below is where is it lurking? There it is. The caiman. And it can't wait to attack a monkey and have a little snack. So in our hardwiring, we have this protective response that enables us to survive threat in the wild kingdom, which most of us don't live in. Fortunately for us, we live in a pretty safe society. But there is such a thing as a freeze response. So you get, in the face of overwhelming threat, you get fight or flight. And if those aren't an option, the default option is a freeze response. Now, excuse me, if by nature you're an opossum, you're going to tend to go into a freeze response as your number one default plan versus fighting or fleeing. And if you've grown up in a stressful, unsafe environment, you're going to also typically have a tendency to go more into a freeze response because that's about your only option. As a child in unsafe circumstances, you don't have often a lot of opportunities or power or control to be able to fight or flee from dangerous situations. So that may be a pattern in your nervous system that is more readily triggered. And some people it's less so, and some people it's more so. So that's a freeze response. Now, why is that of interest in rehabilitation? Freeze response is brought on by paralyzing fear and helplessness. Paralyzing. So that means your muscles don't work right. If you have been in a car accident, you may have experienced a freeze response. Now, maybe overall you're accommodated to it, you don't have post-traumatic stress disorder, and you're doing pretty well, but a part of you could still be acting like a deer in the headlights, even though all of you isn't. So that's a freeze response. That's a little bit about how that affects the body. One other little comment I want to make is that a close cousin of the freeze response is a protective involuntary muscle spasm. Let me bring Pokey back up here. Alrighty. So here we've got an injured area that, let's say, for a long period of time, it takes to recover. So while it's taking a long period of time to recover, the muscles are limiting movement and staying in a more contracted state. And so then you could have a very long amount of time that's going on, and it may not just abate, especially if you have a very arthritic joint that then has a surgery. The body is already very programmed not to say, wahoo, I'm all better, but to say, I'm still really tight and I don't know how to quit it. So a protective involuntary muscle spasm makes that region be the very opposite of Gumby. Inflexible, doesn't have rapid ability to change from one direction to another with motion, and lacks the fine-tuning, fine grading of muscle activity that gives us smooth, fluid movement. So that's it for this part of talking about rehab and theories. And in part two, I'm going to talk about what we can do about these sleeper problems that may be affecting how well you do, how to deal with a freeze response, and how to deal with protective involuntary muscle spasm so you can regain comfort and ease in your body.